Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team at Inovalon, and joining me today is Laura Hart, the CEO at Attest Health. Today, we're going to talk about auditing, the role that data plays in audits, and how all of this impacts health plans. Thanks for being here today, Laura.
Thank you, Justine. It's an honor to be here with you today.
Before we get started, just tell me a little bit about yourself and about Attest.
I'd be happy to. As you said earlier, my name is Laura Hart, and I am the CEO of Attest Health Care Advisors. We are a virtual company that is based out of the San Antonio area, and I live in Houston. I have been working in the healthcare space since the beginning of my career. Funnily enough, my dad wanted me to get my degree in accounting, which I did. But before that, I was very interested in biology and computer science. So his advice to me was that accountants are typically the last ones out the door when a company is winding down, and he was very concerned that I would always have health insurance. So I think it's come full circle now that I actually work with health insurers and payers, and I get to work with data related to clinical aspects as well as reporting. So it feels like it's a match made in heaven. As far as Attest is concerned, Attest has been around for about 20 years now, and we have been a leader in the market with regard to healthcare auditing and compliance and consulting. And so we primarily perform HEDIS and state audits, as well as CMS data validation audits and work related to the IA audits and risk adjustment data validation audits as well. We also have some expertise in the pharmacy space with regard to URAC quality audits as well. So we kind of run the gamut, if you will, with regard to that. But overall, I feel that we are well positioned as a leader in this space. And really, the best part is that we get to work with clients and thought innovators, governing bodies, and we get to share our opinions and help drive where we're going in the future for quality measurement.
And that's kind of leading me right into the next question of this work is really important. We know that auditing may not necessarily be the most exciting topic, but it is so important. So tell me, what excites you the most about all of this?
Well, I have to say, you are exactly right that it's not exactly glamorous, but it is exciting when you think about where we are going and the challenges that plans are facing. Every day is a new day as far as the audits are concerned. We like to say, if you've performed an audit once, you've performed it once. It's not going to be the same in the next year, and the challenges that you face are always different. So from where we are going and what we're looking at, I think it's really important to stay focused on the data, all the new things that are coming into play, especially in this last year. And when I look forward to what's happening in the future, we are going to be looking at brand new types of data that we've never seen before. And we have to find and identify and vet. And all of that is going to be, I think, a really exciting time for all of us. And when I also look at where we are going, I think it's really exciting that we're focusing on outcomes now and seeing if what we're doing is effective. All of that, I think, is really important. And then also the focus on disparities across the social spectrum. I think that is really important as well, and something for us to look into to make sure that there is equity with regard to health access and care.
And I think there's clearly a lot to be excited about, but you did mention kind of those challenges that health plans are facing. So tell me a little bit about what are those challenges and how can organizations like Attest help solve them?
Oh, that's a good question. So when I think of the challenges that are facing health plans, the biggest thing that I feel like they are facing is the continued pressure to report and improve. There's expansion of measures, depending on if you are Medicare or a Medicaid plan. You may have all sorts of different state-specific measures that you have to report, and I think it's really hard to try and keep up with that, especially when you think about the continuum. We have more data than ever, but we have fewer resources. So you have to figure out that balance, and I think it's really tough for health plans to focus on what needs to be done. So that, to me, is one of the biggest challenges that health plans face. And when we look at that, our goal is to make sure that the health plans have the resources that they need and the support that they need. For us, transparency, communication, and availability are key to ensuring that plans can move forward successfully. And so what we focus on is making sure that we're available to help them wherever they may need it, whether that's making sure that the transition from traditional hybrid medical record review type measures is smooth as they go to the clinical data sets. All of that, I think, is super important. And just being there as a sounding board, sometimes that's really all they need. So that's really, I think, one of the biggest ways that we can help plans is just to be there for them to bounce ideas off of, also to look at the data sources that they are coming up with, because it's wide, it's varied, and we are constantly looking at the innovations that plans are coming up with as they try and identify where these sources come from.
Yeah, and kind of back to the data, I know you had mentioned this a little earlier, but the role that data plays in auditing is critical. There's a lot of data that we're looking at, and the data integrity piece is pretty important too. So talk to me a little bit about that, and why is that so important?
Well, if you think about it, data is the foundation for all of this. So data is a foundation for being able to report measures. It's the foundations for being able to make decisions about what's coming or what's next. Data is the foundation for moving forward and checking your trends to see, hey, am I doing better than I thought? So from an audit perspective, it's super important that the data is complete and that it's accurate. If the data isn't complete and accurate, then you aren't going to get the correct picture of what is happening in your world and with your members. So from an audit perspective, it's incredibly important that we have the full picture. If you think about it, if I'm reporting a measure, and let's say it has different aspects, membership and enrollment, claims, provider data, also there may be pieces of it that are coming from a vendor, like pharmacy. So if I have an established process to extract data and transform it so it can be loaded in order to report, it's really important that I have all the pieces. If something changes and I'm not aware of it, then the whole data set would need to be replaced. So our job when we go in and we look at these processes is, do you have controls in place in order to ensure that there's communication if something changes? So let's say your members' benefit codes change. You need to know that. Or let's say your pharmacy benefits manager data is moved to a different table. If you don't know that, you will know real quick once you run your production rates that you are missing critical components and your overall picture is wrong. So that's why we need to make sure that there is integrity with the data and that there are processes in place so that if data were to move, there would be communication. If data were to change, that would also be communicated to those downstream entities that utilize the data. So that's the importance of integrity within the process, because if any of it is wrong, then your final results will not be correct either. So as they say, garbage in, garbage out.
Exactly. So we know that the integrity of the data is important. What can these payers be doing to ensure that the data is good?
Well, I think it really comes down to making sure that they have appropriate internal controls over their data. So from the systems perspective, from an operations point of view, your systems are going to be locked down. You're not going to be able to make changes to your claim systems, to your enrollment systems, without going through a systems development lifecycle type process. So there's going to be testing, implementation, user testing, and acceptance. All of those pieces have to happen. Those are all part of internal controls. So that piece is probably already there. There's probably pieces also where you are making sure that data going to the warehouse is appropriate. So we just want to make sure that those things are in place. And then from an internal controls perspective, that if something were to change, there is a process to ensure that it's correct. As we move forward and look at all the other types of data that are coming through and are being utilized for all sorts of reporting, so looking at EMR data, data coming from the HIEs or data aggregators, all of this data too has to maintain integrity. So in order to ensure that it is indeed appropriate for use, then we have to look at any types of QA that are performed. So are you looking at the data and taking it all the way back to the source? Are you double checking that the codes are correct? These are the types of things, because it's utilized for reporting, and that reporting is utilized in a lot of aspects for reimbursement, then it's really important that you get it right.
Yes, coming back to the reimbursement piece of this is always huge. And I think there was a lot of advice already kind of weaved throughout this conversation. But just to close, I'd love to know, what is one piece of advice that you would give to a health plan payer with the kind of current state of healthcare today?
I don't know that it's really one piece, but I would say my biggest piece of advice would be to breathe, to take a moment, to always be looking at your data strategy, because it will evolve and you have to evolve with it.
Well, that's awesome, Laura. I love it. Thank you so much for not only the advice for our payers, but the great insight that you've shared today. It was great chatting with you, and really appreciate you joining us for INOvators today.
Thank you so much. And again, thanks for having me.
Of course. And thank you, of course, to our audience for tuning in today. Be sure to join us for our next INOvators episode.